Hello, my name's Deborah Billings, and I'm a researcher and faculty affiliate with the Institute for Families and Society at the University of South Carolina. In 2020, we launched a major qualitative research initiative carried out by a multidisciplinary, multiracial and ethnic, and multilingual team in collaboration with community organizations. The Voces initiative documents the experiences and voices of Black and Latinx immigrant women as they experience birth, pregnancy, and postpartum care, while using Medicaid to cover the expenses of that care. With the global pandemic, COVID-19 became a major factor, exacerbating issues and challenges and barriers that already existed. From the very beginning of the initiative, the Institute for Families and Society supported theater as a major mechanism for sharing the experiences of women and bringing their voices directly to the table to discussions about healthcare, health insurance, and policies in general that affect pregnant women. To that end, a playwright has been part of the core research team from the very get-go. And instead of creating a performance where characters were based on our research findings, she actually created a performance where the actors speak the words that were shared with us by women during the interviews. In this way, we feel like we've been able to better lift up the voices and experiences of women, and especially their call to listen to us. We wanted to share the important messages shared with us by women through the interviews with a broad array of audiences, including healthcare professionals, students of healthcare professions, policymakers, healthcare practitioners, community organizations, and community members. We feel strongly that the messages encapsulated in these performances are relevant to so many people. Our aim is that the materials on this website will generate deep discussions about core issues, including issues such as equity and justice, and the ways in which these are put into practice in our healthcare systems and other systems of care, as well as making very clear the ways in which they're not put into practice and what we need to do to change that. There's no prescribed way to use the videos. What we suggest is that before organizing an event, review the footage and consult the Voces technical report, both of which are available on this website. That way, you'll be very familiar with the research approaches that we used, and you'll also be familiar with the content and the different themes that emerged from this work. On the website, we offer two options that can meet the needs of different audiences and events. The first is a series of monologues. Each monologue focuses on a different theme, and those monologues are followed by specific discussion questions that focus in on that particular theme. You can use these materials alone or in combination in events like classes or grand rounds or community events. The second option is a full-length recording of the entire theatrical performance, and that lasts approximately 1 hour. We suggest that you use that material in events that have at least 90 minutes available where you can show the entire theatrical performance and then have time for deeper discussion. So on behalf of the entire Voces team, thank you. Thank you for caring. Thank you for your interest. We look forward to hearing from you, hearing your reflections about how you use these materials and what the impact has been. We also ask that you share these materials broadly across your networks with your colleagues, friends, even family. And thank you.